I'm Dr. Cedrek McFadden, and I'm a medical contributor for a Sunday morning radio show with Pastor Lenny and comedian Akintunde. As of now, there is no FDA-proven cure for COVID-19. There are several things that are used to treat COVID-19, and there are several items under investigation, but there is no cure for COVID-19 as of now. So hydrochloroquine is a well-known medication that's used for, it's anti-malarial medication that's used for treating lupus as well as rheumatoid arthritis. However, its safety and its use for the prevention or treatment for COVID-19 is not recommended. There are some restrictions from the FDA, and at this time, despite many sort of desires for it to be the drug of choice, we don't have the data. The research does not support its routine use for the prevention and or treatment of COVID-19. In order to prove that a medication can be used for the general public, we have to do lots of research on it. It can't just work for one person. It can't just work for 200 people. The research has to show that, number one, that it's effective across wider demographics, that it's safe for, people that have certain medical problems. And so part of that research goes into demonstrating, what are the effects of it? If people have heart disease or diabetes, does it still work the same? What are the side effects? And are these side effects going to be tolerable? Before medication can be used in general public, it has to be proven to be safe, and it has to be proven to be effective, and it has to work. And that's what we are still waiting on with many of these medications. So yes, masks are effective at slowing the spread of COVID-19, but it's just not all the masks. I mean, we have to do our part. We have to continue to provide social distancing. We also have to work on hand hygiene, and we have to wear the mask. And so we can't rely on the mask to provide all of the success that we need in controlling the spread or slowing the spread. It has to be a part of an overall bigger picture of us making sure that the illness itself no longer spreads in our communities. At this time, we don't have a magic pill for COVID-19. We have recommendations to wear the mask, to continue social distancing, and to keep our social bubble small. So that means that if you are having parties with people outside of your home or people that you don't know sort of where they've been and really can't trust that they have been doing the same, then you're putting yourself and your family at risk. So continue to do the things that we know can work so that we can continue to see decreasing numbers of COVID-19 in our communities moving forward.
What's your process for creating this awesome music?
I just think for me is life experience and my experiences with God. I wrote Better for his on a Wednesday night Bible study on the back of some message notes while he was preaching. Never knew that the song would be number one for over 20 weeks and get nominated for a Grammy and all of this stuff.
Good stuff. I mean, just the fact that you stuck around for 16 years. I've been pastoring now going into my 16th year, and I've been thinking through a couple of options here and there along the 16 years. So, man, bless your heart. You can probably teach some folks.